from the station that's on your side. This is Channel 7 News Daybreak.
Hey, everybody. Welcome back into Channel 7 Daybreak. Today is Wellness Wednesday, and Dr. John Allen Cockerell from Baptist Health joins us this morning. We're talking about the increased level of alcohol consumption during the pandemic and how it has led to some studies and doctors saying, hey, this is something we need to discuss, bring awareness to people, because, Dr. Cockerell, this could be something that people during the stressful times of a pandemic might not even realize. What are some of the numbers that you can share with us this morning about what the latest studies have said about these increases?
Absolutely. Be happy to. This is something we want to bring up almost as like a public service announcement to say, hey, kind of check yourself, check those around you and see if you fall into, some categories here that may not be so savory. We want to help you out if the alcohol consumption may be an issue for you. You mentioned those studies. The NIH has studied this. Other entities have as well. But in some areas of the country, we've seen abnormal drinking, not just drinking, but abnormal drinking up 30% some places, right? So this is something that really hits home here, in Arkansas, but also nationwide too. There's definitely abnormal drinking patterns on the rise. Biggest three reasons that the NIH has identified for this is all pandemic related, right? But would be boredom, availability, just the fact that it's there and there's not much else going on, right? And then obviously the psychological and economic stress of this time too. So we've seen significant increases in abnormal drinking and just wanted to bring it to folks' attention today to see if we can help out with it. So,
all right, when you say abnormal drinking, give us an idea of what types of standard drink sizes you're talking about and how people have exceeded that by those numbers you just mentioned.
Right. This is huge. And this may be sobering to some people to think about. So a standard drink is defined as 12 fluid ounces. So in terms of alcohol, right, 12 fluid ounces of beer is equivalent to 5 ounces of wine or 1.5 ounces of hard liquor. Now, that's not much in terms of what some people are used to drinking. That's what a standard drink equivalent is. So in terms of what's drinking versus abnormal drinking, it comes down to frequency, right? So how often you're consuming those standard drinks. For men, right, drinking a standard drink, right, specifically 5 standard drinks at any one setting is considered abnormal drinking. For women, the number is 4 standard drinks, at any one setting. And in terms of daily consumption, for men specifically, 2 standard drinks per day is upper limits of normal. Above that's considered abnormal, right? For women, 1 standard drink per day. If you're breaking through that, technically you're in a category of abnormal drinking, and that's not to just characterize, people for what they're doing and make them feel bad about it, but it's an awareness thing to know, hey, the alcohol coming in can have some effect on you.
And it's important to recognize that so that you could either help yourself, help someone you know, or seek professional help for yourself or someone that you know. And I know Baptist Health has resources available that you can find a physician, either your local physician, or you can go see one of the folks at the Baptist Health Rehabilitation Institute. There's a lot of opportunities out there to help yourself. Dr. John Cockerell joining us this morning to discuss just a few of these options. John, thank you so much for taking some time out of your day. We appreciate you, and go to baptist-health.com for those resources.